MedBix Webcast is a new kind of healthcare media channel to break the silo mentality and foster interdisciplinary thinking. Our mission is to fill that gap and to create a curiosity through different lenses, tapping the passion that guided the historical figures in medicine and bringing present-day groundbreaking research to the front lines. We interview physicians and leaders in the industry about present-day healthcare challenges on our live programming. Hey, welcome to the MedBix Webcast. This is Ramana Annamaraju. I'm not Albert Einstein. Maybe my guest is, but so welcome. So we have a special guest today. You know, he's a very senior physician and a ER doctor, and they have a lot of extensive experience in emergency room medicine and also with the healthcare insurance companies. He's a corporate medicine. He practiced corporate medicine. He understands the insurance companies. He understands the delivery of the care. So we're going to talk about those. We're going to ask him about that. After that, I'm going to present a topic. It's an interesting topic about the beauty that people think about beauty and some kind of a mathematics connection. Beauty and mathematics connection done by one of the 1000th century Italian man. I'm going to talk about him. You're going to listen to him, and it's really interesting mathematics. Why some people they want to look beautiful, but what is a particular mathematics relationship? If you to understand this one very well. Without further ado, let me bring Dr. Dennis Koper. He's an emergency room physician he's a fiercely capitalistic. He's from Texas. There's no surprise there. So welcome. Welcome, Dr. Koper. Welcome to the MedBix Webcast.
Appreciate it.
They give me some your professional and personal background a little bit.
Emergency room doctor, practiced out of training for a while, started my own business, and then wandered into the insurance, the health insurance space, working my way up to chief medical officer of a publicly traded healthcare company. We successfully reversed their fortunes, took them from an underwriting loss to an underwriting gain. Company was sold, and I ventured out on kind of an entrepreneurial bent, started a workers' comp company that managed workers' comp indemnity claims. We had built our own predictive software and was able to ultimately sell that company and started a host of home health companies. Have enjoyed my time in medicine. I'm back to practicing during the day. So that's pretty much in a nutshell, Ramana.
I don't know who is Grace. Do you know who is Grace is?
I'm sorry, I didn't understand.
Okay, somebody came in and I didn't know that. So, but anyway.
Grace is my daughter. That would be my daughter.
So I took her out. Please ask her to come back. She wants to come back. Ask her to come back. Sorry about that.
Yeah, that's okay.
She wants to join and say some things. More than welcome.
Okay, I'm going to say. Go ahead.
So yeah, let me ask you a little bit of couple of questions about what is going on with healthcare insurance. We are going through a paradox. Let me bring you both of us. We are going through a paradox. American healthcare system cost is going up, quality of the healthcare is going down. What is in this vicious circle? What is the role of the insurance companies? And now we have a lot of different kind of insurance companies are there. Tell us a little bit about your understanding of the insurance role with the physicians.
The role of the insurance company obviously is the fiduciary. So whatever pool of insured you're in under that insurance umbrella, their responsibility is to pay claims based on the what's called specific plan documents they've put forward. It could be an underage group. That's typically what most employees are in with their employer. So it's under 65, just general health care. You can have, Medicaid. You can have the CHIP program, which is for children Medicaid. You have Medicare, you have Medicare Advantage. So there's a variety of, and that's just health insurance. I mean, there's other insurances that involve healthcare, whether it's workers' compensation, short and long-term disability, the PIP coverage in an auto accident. There's a variety of places where medical care comes under the insurance umbrella. I think most of us are familiar with A&H, accident and health companies, which provide health insurance. And to me, their role is you collect premium based off actuarial data, which means we take the population we're going to insure and we estimate what their costs are going to be and then what the administrative costs are. And we divvy that up and that's what people pay. And then they're responsible for paying claims.
Let us talk about a specific plan, for example, Medicare Advantage plan. So, okay. That's the biggest insurance plan after the Medicare by itself. So I heard quite a reviews about the spectrum about good and bad. What is your opinion on the Medicare Advantage plans? Are they working, or they particularly depend on the people who are managing this Medicare Advantage plans?
I think they're working. They have a tendency to be able to pluck the younger Medicare members, so they get a healthier population. Medicare Advantage is very misunderstood in our senior population. The first thing is if you're a Medicare Advantage plan, you have to follow Medicare guidelines. In other words, they cannot make up their own rules. Whatever Medicare pays for, they have to pay for. They're allowed to pay more for other items, but they have to cover what Medicare covers, and they have to use appropriate guidelines to do so. I spend a lot of my time now with Medicare Advantage folks. I think one of the biggest problems we have in healthcare is when our politicians get involved. I constantly tell folks that, when Medicare pays a Medicare Advantage plan for a member, and that's how it's funded. They take money out of the Medicare Trust Fund based on an individual's health acuity and give that money to the Advantage plan they picked for their care. If it's an overpayment because their health has been or the acuity of their health has been overestimated, the insurance company gets to keep it because that's what Congress said, which is absolutely, it's just wrong. On top of the fact that Medicare Advantage plans are paid over $1 for $1's worth of insurance coverage. So in other words, a profit was built in ever since Medicare Advantage started. So they've got way better lobbyists than the American people because they're set up financially to be very successful. Having said that, I think, most of the plans do a good job, whether you're, Humana, United, WellCare, Aetna, what have you, they do a nice job. But I still think it comes down to an individual with their individual doctor, especially their primary care provider, and what relationship that is there and how invested the individual is in their own health, which will determine the outcome of their treatment.
Very good. What about some complaint about cherry picking? That's Medicare Advantage plans pick up some healthy patients and then they discard the patients who have problems.
Sure.
Problems.
It's going to happen. I mean, if the healthy 65-year-olds that roll over, if especially the ones that are, financially struggling, the Medicare Advantage plans provide, a lot of them provide zero premium, low premium coverage that you're not going to get on traditional Part A, Part B. So it's very attractive to those members. If they're healthy, the insurance company gets paid and they don't pay a lot of claims out on them and they make money. There's a reason why Humana quit the underage market and now is solely in Medicare Advantage. It has to be, financially attractive to them, or they wouldn't, just put all of their eggs in that one basket.
Yeah, Humana CEO is on the part of it, by the way.
Okay.
You may be watching that program.
More power to him. I mean, obviously they felt like they struggled with the underage market. And yeah, they've done a great job lobbying Congress. It's set up very advantageously for them. And, if they provide quality care, then that's what, the Medicare population deserves.
I'm going to ask you about the account care organizations, a question about how they're doing it and what do you think of the account care organizations, ACOs?
Um, Again, it goes to how invested they are in taking care of their members. Accountable care organizations, to me, we go back to we're dealing with PPOs or HMOs. I think a better way of going about this, and I think Medicare has come to this conclusion, is risk-based contracting, where they take a population. A lot of them are, chronic conditions, whether it's chronic kidney disease, diabetics, whatever it is, asthmatics. They will take a significant population. They know what their medical spend is, and they give that population to a group and say, you manage it. And if you can manage it better than what we have in the past, you will financially benefit from it. And I think that's how you go. We're talking about paying for quality of care instead of quantity of care. So I think even the ACOs, until any organization that's managing care is brought under a risk-based umbrella, they're going to be managing on quantity and not quality.
I'm going to be devil's advocate. For example, ACOs, they say that less provide you care, the more you save. So that is also, there is a problem in that kind of a direction. Some people comply, and consumers at least comply.
I have a problem with that because, anybody that calls himself a physician or a private, a primary care provider, a doctor, a nurse practitioner, you have a Hippocratic oath. I mean, so what you're saying is that I am going to put my financial well-being over and above my patient's physical well-being. And I know it's the human nature. We got the bell curve. 10 are great, 10% are bad, and then we have everybody, the 80% in the middle. I just have real trouble believing, people will do that, will put their own financial incentives in front of taking care of people. I go in people's homes every day. They're on Medicare Advantage. I'm looking at their health to verify where they are with Medicare. And most people, they want someone that cares. They want someone that understands what their health conditions are and how to improve them. And they just want some human connection and human compassion. So, I mean, I don't think we'll ever get rid of the bad actors, but I do think the vast majority of physicians that have put their time in to train and study are trying to help people.
Dr. Koper, if you are a true proponent of capitalism, the thing is that the outcome should be the patient-centric care. Patient should be in the center of the care. That is the center of the capitalistic system. Do you agree with that?
So I think we're talking we're kind of mixing metaphors. I don't. I think when I'm talking about capitalism, I'm a very staunch advocate that the more the federal government gets involved with our healthcare, the worse it's going to be. That's just my opinion. I feel like, I know people will defend the UK system or the Canadian system, but there's a reason the Canadians come across the border into Detroit to the cash to spend money to get taken care of. I don't, I feel very strongly the best care in the world is delivered in this country. Having said that, studies have shown it's very expensive care. I don't disagree with that. I feel very strongly that it comes back to the fabric of America. An individual is responsible for themselves. I'm responsible for my health care. I'm responsible for what I put into my body, what I do to improve my body. Now, from a genetic coding standpoint, I got that from my parents, just like you did. So there may be certain issues I have to deal with, but my job is to figure out how to deal with those in the best way possible. I have an advantage. I went to med school, but if I'm a citizen of this country, I'm looking for a provider that cares about me, that will talk to me, and that will invest, with me in my healthcare. And I'll be honest with you, I think physicians, a lot of practices have sold out to private equity groups. They've sold out to hospitals. And so now they've got another master, and they're told they have to see X number of patients an hour, and they don't have the time to spend with patients. But a lot of that's on us physicians for selling out. I just feel like if you can get someone to invest in their healthcare, and we start at the grassroots basis, that's how we improve healthcare in this country.
Talking about patients, you said that something interesting. They need to know, they need to invest in their own health. That is an education is the main thing. What
Absolutely.
do you think of, so what do you think, how do you proceed in that direction? What suggests you, what do you suggest?
I feel like here's an interesting anecdote. I have been speaking to the medical school I graduated from about teaching a course to 3rd and 4th year medical students and to the residents about how the health insurance industry works so that they have a basic understanding of insurance. I think it would bleed over when they're, they got homeowners or they got car insurance, it's going to bleed over, but how it works, because medical students and doctors are not taught how it works. If that's the case, how do we expect the average American to navigate the system? I feel very strongly we got to go back. And I don't know if it's middle school, high school, but we got to teach folks, because, we're at 20% of our GDP we're spending on healthcare. Is it probably more than it should? Yeah. Is a lot of that legislative? I think you can just look at drug prices and know it's legislative. We basically foot the bill for the world's pharmaceuticals because of the cost structure we allow to happen in this country that's not allowed to happen in France, Canada, UK, Japan. Wherever you look, their drugs are way less expensive than ours. So I just feel like we've got to start with the American public at a young age and educate them so they can navigate this system. The healthier we are, the better off we are as a country. I mean, whether it's a country, the healthier your employees are, the better off you are as an employer. So, I mean, and some people just aren't going to invest in their health. That's their personal choice. But I don't think the rest of us should bail them out because they chose to smoke 3 packs of cigarettes a day. Or they're going to drink a 5th of whiskey. I feel like, you make an individual choice, and that's kind of how we founded this country is, then you deal with your choice you make.
I agree. No more. I agree 100% with you about the education part. I think that is fundamental to India. My father is a teacher and a doctor. He was teaching healthcare all the times, kids and everybody around him. That is the. I agree. In a small village, in fact, he was doing that. I think that there's a doctor's responsibility teaching that, educating people about health, and patients themselves getting education is a very critical part of that. Maybe starting in 3rd grade, 4th grade, or middle school, or high school, it must be there. I agree.
So I just want to add one other thing. I feel very strongly every time a patient leaves a doctor's office that the doctor should be saying to them, when you come back, here's your, it's basically like you got from your teacher. Here's your homework. When you come, I want you to do these things so that when you come back, you can show me that, you're invested and you've done some things that we've talked about in here that you were saying were symptoms or problems you were having to work on improvement. And I don't think that happens. It's just, hey, come back and see me in 3 months instead of, I need you to work on these things and then come back in 3 months.
So let us talk about the second part of the delivery system, healthcare delivery system. We have healthcare hospitals. I have friends who owns hospitals. They said that last time I met him, and he said that every hospital is losing money. So that is how can they provide services if they're losing money? How long they're going to sustain like that, continuously losing the money, or we have to rescue them. It costing us more. So do you think their existence itself is, we need to question that? Or we need to provide a different kind of a structure, a silo structure?
I feel very, I've grown up with the hospital system. I feel very strongly we need it, whether, you're in a car wreck or you have, blunt trauma, or penetrating trauma, you have an issue, you need an ER, you need a hospital. I just feel like, for a long time, hospitals were overused, overutilized. And so as we back off of that, issues pop up, we can't make any money. I know the rural hospitals are struggling to some degree. But again, if you follow my logic, the healthier we make the United States population, the less and less we should need, or the utilization of hospitals will decrease, time over time. So, and again, it's a capitalistic society. So the strong survive, and, and you have to be able to provide care. I understand when we start going out into rural communities, you have to be able to get to a hospital because sometimes, time is life. So there's that issue that comes in, but again, it's capitalism. I mean, if you provide care and you provide quality care and you make money, good on you.
But what about preventive care? Nobody is that there's no money in the preventive care. A lot of people don't care about, we develop a sick care, not a preventive care. What do you think of how do we develop that preventive care as really a system that can deliver healthcare better and make the patients better?
Two-part answer. One is, that's where risk-based contracts come in, because if you're a provider group and you're under a risk-based contract, preventive care is a strong mechanism you use to hold costs down. I mean, if I'm taking a group of people, diabetics, I've got to educate them. I've got to follow up with them that they're following diet, they're following exercise guidelines. We're maintaining or trying to lower our A1C. So preventive care, if you're in a risk-based contract, that's going to bring money back to you. But preventive care should be the basis, again, of educating the American public. Like I said, middle school, high school, is you have to take care of yourself. And these are the things that you have to do. When you're a kid, you get fluoride on your teeth, you brush your teeth, you do those things. As we get older, we start talking about mammograms and colonoscopies. We start talking about flu shots and pneumonia shots. There's a variety of things that have to happen. But again, it's education, and you have to educate the populace. And again, to me, that's where pediatricians, that's where family practice docs and internal medicine, the folks on the front lines providing care, they need enough time that they can get those things taken care of.
I'm good. Yeah, well, I'm going to present now. I'm going to present a topic on plastic surgery that is coming from there. And then your daughter is actually present. She can come on camera, and then she can listen to the presentation, and she can give her opinion. Let me bring Grace. Please come on the camera. Oh, very well, Grace. Welcome to the.
Hello.
We need your input.
I'm here with me and Tony are here.
Okay, hi. So, Grace, welcome to the MedBix webcast.
Thank you. I've been enjoying it so far.
So let me present the MedBix webcast. We all three are going to watch it together, and then tell me. You can jump in anytime, Grace. More than welcome. This is more related to the woman. Okay, that let me bring all of us. Yeah, that's it. We are all three watching together. Okay. This is about going for a surgery, plastic surgery. What understand this man? Who is that man? We're going to find out. It is in 2005. There was a beauty pageant in Korea. The judges were surprised. They see all the women look exactly similar. It's not a stereotyping. I'm Indian, so I'm not stereotyping. The Korean press said that they look exactly same, eerily similar. That is the reason. The funny reason was they went to the Gangnam. That's a new guy. That there is a music video, Gangnam Style, Gangnam Golden Ratio plastic surgery. They went in Busan, Korea. So most of them went to this plastic surgeon. They wanted to look like a Hong Kong actress. Everybody looked exactly same because he made them look same. So all the Korean contestants looked exactly same. That was shocking to the Korea in the beauty pageant. So what is that golden ratio? That's what I'm going to talk about. And then the guy who is involved with that. Golden ratio came from a Greek sculptor. Is Phidias, his name. They say that he is the perfect man. I don't know what that means, but it's a perfect shape. That means he has to have if he is 3 feet tall from a head to the navel to the feet is a 3.6. The ratio is a 1 to 1 to 1.6. That ratio, if you manage that is called a golden ratio. So if you have a golden ratio, that is supposed to be the beauty standard. That's a Greek sculptor was a god for that kind of a definition of golden ratio. So golden ratio, actually, the practice in the plastic surgery, in the beauty defined is in your upper lip. If you want to get an upper lip one centimeter and the lower lip is 1.6 centimeters, that is supposed to be the beauty defined. That is a plastic surgery. That one of the definitions of the golden ratio. Another golden ratio is if you have eyes. If your eyes are the same thing that you do 1 to 1.6 nose, all of them we follow golden ratio. The size between the eyes, the length between the eyebrows, that is what the golden ratio has to be followed. The chin, nose, all of them follow the golden ratio compared to other ones. That is supposed to be the beauty standard. That is called a golden ratio. But what is this golden ratio? So you can hear artificial intelligence. I'm in Silicon Valley. When I come back, I'm going to ask him about the technology role in healthcare. But Dr. Koper, but artificial design, the human body, this is a golden ratio. You can actually extrapolate the entire artificial design to the entire body for man and woman both. So there was you can do from A to top to toe. You can define artificial intelligence design the human body. You can do that with the golden ratio. Those are all golden ratios that how they work in each other comparison. So everything from foot to the toe, head to the toe. So that is a golden ratio. You can define it. What they found out, some of the guys, interesting guys, there is a perfect body. I didn't know that. But the actress Helen Mirren has this golden ratio perfect body there. So she followed. I don't know who measured it, but that's a leave to imagination for you guys. So that is the actress Helen Mirren as a perfect body. Now you're all going to go and check it. The golden ratio, the story starts with the mystery. Golden ratio begins in the Italy year 1100 AD. That is the story starts in the 1100 AD year. Leaning Tower of Pisa, town of Pisa, where the Leaning Tower is in Italy. So that's where the story started. His name is Leonardo of Pisa. His name is Leonardo Pisa. He was born in 1170 to a naval merchant, a naval trader. He's a merchant trader. In 1170, he was born to. He was the son of a trader. Actually, they trade through the ships. Naval trader, naval merchant trader. So he's also called Leonardo of Pisa. Is also another name. His name is Fibonacci. Fibonacci is another name. They gave their name after that, and that's why he is known as a Fibonacci. Came another Italian hero. Marco Polo is another traveler. Fibonacci was born not long before he was born. After the 50 years after Fibonacci died, the Marco Polo started his journey, but Fibonacci was way before. So Fibonacci used to travel from African travels. He used to do with his father with the Sardinia, Italy to Annaba, Algeria. That is a 200-mile trip from a Sardinia to Annaba. It's a 200-mile trek. During those days, 1100, you have to go 2-3 months. It's not like you go there, you fly for an hour and come back. So it is not. That's the case. They are using ships and they are merchants. Remember, they're the Italian merchants going to the Africa trade goods. They used to go to Annaba, Algeria. So he was traveling with Fibonacci. He was traveling with his father. So they used to take silk and wine. Wine is Western people imported wine to all of us. So silk and wine came. They used to bring the silk and wine, and then Africans used to sell Indian spices and gold jewelry to them. That's an exchange. Wine and silk and the spice. That's why the traders come to Annaba to exchange. The African traders used to go to India and pick up the spices and gold and come back and doing the trade in the Annaba port. That is the anything. All of you, anytime you want to jump in, please jump in or ask questions, please.
Fascinating.
So, so that uh, that the Fibonacci sort. So they have to exchange. They have to count something, right? They have to count jewelry. They have to count all the spices. They're counting. So Italians are using the Roman numerals. The Grace may know with quite a bit than us. 1, 2, 3, 4. All the Roman numerals that are there. So you see on the left side of me. So the Fibonacci is familiar with the Roman numerals, but Africans are doing something different. He was surprised to see numbers only. If you see the number 9 in the Roman numerals, like 4 letters. If you see a different number in the Africans are using only 1 letter. He was surprised to see simplicity of the numbers, and then he saw one surprising thing. He saw a one letter 0 he never seen before. He was shocked to see 0 there, and then that was a huge surprise to him. Fibonacci Western people never know about 0. Actually, that number system came from Hindu Arabic numerals. Actually, Hindu numerals. It was born, that numerical system with a 0. 0 was invented in India. It's a 2nd century BC. That came from India. That was, they're practicing Hindu numerals. They used to call Hindu Arabic numerals, but Hindu numerals, Devanagari numerals, they call. There's a 0, 1, 2, 3, 4, 5. The single numbers in the bottom, you see, that is now what you see is many Western numbers. They're basically translation of the Hindu numerals on the top. That 0 came in, still you see the 0 there. What is the 0 that is doing there? Fibonacci was a very curious young man, and he wants to know what it is. It came from the first time they understood the 6th century base system. India started a base system of 10. So 1, 2, 3, 4, 5, 6. If you see 10, 100, 1000, where the 0 is placed, it has a value, different value. His name is Brahmagupta, a sage, produced this placed a base system in the 6th century that they were using in the Anaba. The Fibonacci was very curious, very fascinated by that, and he learned quite a bit. And then he came back to Italy, and he wrote a book. He wrote called Liber Abbasi, Book of Calculations. He wrote first math book, Western book with the Western numericals. He did the first math book. It is called mathematics book, Liber Abbasi, Book of Calculations. That is called in this book. He mentions it called a modus sindaram. That's method of Indians. He said that he used to call method of Indians. So he wrote a first mathematics book in Italian in the 1100s. So he became a very popular guy. So that made, Roman numericals are very tough to use it. If you have a 9,000, you have to put so many letters. So the place values change the entire thing. Okay. So that is the power of the zeros started in the place value. Then Fibonacci also came up with one of the strangest sequence. It's very trivial but very strange. I can tell you why it's strange. So if you add the two numbers 0, 1, you add the 0 and 1 together, 1 plus 2 is 3, 3 plus 5 is 8. So adding the previous two numbers, that's what created a Fibonacci sequence. You think what is the big deal about it? Is a trivial number or trivial, adding two numbers back. I tell you what is the big about it. What is the big thing about it? Fibonacci sequence are all over the nature. Everywhere you can find it. Fibonacci sequence in the petals, for example, they follow a Fibonacci sequence. If you see a flower, it has the petals 2, 3, 5, 8. You don't see in between. So it's followed the Fibonacci sequence. Nature followed all the shells you see, everything it follows. All of them are corn you see, that is all follow Fibonacci sequence. That is the strangest thing. And the second part is you can see in biology, Fibonacci sequence you can see in biology, if you do the knuckles to the wrist, the measurements, you see the distances between them is a Fibonacci sequence. It follows 2, 3, 5, 8. And the Fibonacci sequence in the stock market is called a Fibonacci retracement. The follow Fibonacci retracement, see that how the stock market works. I don't know much about stock market. Maybe Dr. Dennis Koper can tell you more about it. So So then Fibonacci sequence ancestry, for example, you can go back a Fibonacci sequence using to find your first person in your family gene pool. So how long you can go to see the first person in the gene pool, number of steps it tells you. So Fibonacci sequence is another one. The golden ratio that we are talking about, the BT standard, it came from the Fibonacci sequence. If you take the two numbers after the 13 over by 8, 34 over by 21, you would divide the numbers, is always 1.6. You can go all the way to the infinity, that's a 1.6. After the 8, any number you divide by previous number, the following number, it is always 1.6. That's a golden ratio. That is what is strange about that. That sequence is the Fibonacci sequences. They found out 1.6. You see everywhere that ratio. That is a strangest part of the nature. So there's a lot of actresses follow. So they said that these actors followed that Fibonacci sequence. The lips that she did that. Grace may know her, but I don't know that the actress. So ice, the golden ratio ice, they followed. A lot of them are, in Korea, Korea is a plastic capital of the world. They followed the lead, that kind of things. They want to get the Western ice, so they followed the golden ratio. That is the key. So, but beauty standards are wrong, Matt. They're doing beauty standards are, if you're a horrible person, if however good looking, nobody's going to talk with you. So that's not a standard really. But what about the Fibonacci's new kind of thing? Fibonacci sequence is a new biomarker. In the gait analysis, if people are walking around, and then you can figure it out by Fibonacci sequence, with the Parkinson disease, Alzheimer's disease, MS, by seeing by their walk itself. Fibonacci, the steps are 2, 3, 8, 15. If they follow the Fibonacci sequence, they may be potential candidate for the Parkinson or Alzheimer or MS. That's the strangest part. You don't need a MRI, CT scans, and all those things. You may need it, but it is actually good indication that for the Fibonacci sequence new biomarker, it detects the breast cancer very effectively. Cell division is almost in the cancer. Cell division is one cell divides into two divides into 4. That is the division, normal divisions. In the KZ divisions, it is also, if it follows the Fibonacci sequence, it's a nature, that's a problem right there, and it is a cancer. You can detect the cancer if they follow the Fibonacci sequence. The divisions are. So the another one is the neobiomarker Fibonacci matrices. So you can put to detect a breast cancer or any cancer, you take a temperature patch, just to put a patch on it, and then it can tell you that, particularly if you do mammograms on a lot of women, the breast cancer side, it's a lot of false calcifications. Dr. Koper can testify that, so they do biopsy, and then they find out it's a calcification. They do another biopsy biopsy looks like another problem, and they do another biopsy and keep on going. That's a big problem. So so they don't know it is a malignant or a benign. So you can do simple temperature patch. You can put it there and connect to the computer, and then you can do the Fibonacci sequence. If you see that Fibonacci matrices they call, and if it comes out, it was more than a 0.7, it is a malignant. If it is less than 0.7, it's a cancer free. Think about that. If people who do not have MRI, CT scans in Africa and in Indian poor villages, they can use a simple temperature patch. They can do that. So a 1,000-year detecting cancer, for example, is inexpensive. You need a CT scan or MRIs. Now, disposable patch. Think about it. The future of the cancer detection is a disposable patch, and an iPad or a phone can detect all these things. It is a fascinating. A guy from 1100th century, the 10th century, a mathematician gave a definition of all these things. He is providing a beauty of mathematics in saving lives. His name is Leonardo Pisa of Fibonacci. Thank you for listening. And I'm going to bring all of the three of them and she asked their questions. So let me bring a Grace also. Yeah, that. What do you? Just a minute. So hi Grace, what do you think of the Fibonacci?
It was really interesting. It was cool to like the cancer one. I guess I would have never have known that. Obviously, I'm not in med school, nor do I plan on going to med school. So that was interesting to know. And it's also nice to maybe think because I'm 23, so I've never had a mammogram, but maybe not to ever have to have a mammogram because I've heard from certain sources that they hurt, they don't feel great. So to stick like a temperature patch on it, that would be a cool way to do it and it not hurt.
Yes, that's the future of the care. Is not ready to go. It's all under research still. But think about that. A mathematician in 1,000 years in Italy gave that kind of thing. What do you think, Dr. Koper?
It's amazing. It's just kind of the evolution of, the universe and human beings, that mathematical equations overlay a whole host of issues. So it's fascinating.
Okay. So I'm going to ask you questions about. So Grace, what do you think of healthcare for 23-year-old? Or my daughter she's getting married very soon, and so she's a little bit older than you are. But they what do you think of what is the healthcare system? What do you think of from your point of view?
Um, I think I've always had a different point of view because obviously I've had an in-house doctor my whole life, and most people don't have an in-house doctor. Um, I think right now it's hard, especially after the pandemic, because so much was virtual that I think a lot of people my age kind of forgot or just never got into the habit of like actually going to the doctor and having like your normal like yearly tests done. So I think that, and then also I think the internet, people are, they like to, I always like to say they like to play at home doctor, and like they see something on the internet and it's like, if you go out and eat 14 blades of grass every day, you're never going to have cancer, but that's like not true. um so I think it's like the resources are there in the healthcare system, but I don't think that people are maybe using them as they should. um
You
yeah.
made excellent point, Grace. So I'm going to ask him, Dr. Koper, about that. I'm in the center of Silicon Valley. So people follow ChatGPT. So, example, ask questions on ChatGPT or a board. All these questions they ask, and then they think is real. Most of the time, as you say, 60. If you drink a coconut water, they cure cancer. All these nonsense they put together, and how do you deal with that one, Dr. Koper? And the technology is it trying to solve the problem, or just all this technology making a lot of noise, and then they project themselves as intelligent, and then nothing is going on there, as you say.
I think now it's a combination of the two. Although I think over time, um, the machines that can handle large data sources and provide information are going to be very valuable. I would obviously, whether it's protecting my turf as a physician, I think I would proffer the idea that individuals using ChatGPT to be their own physicians is dangerous at best. I think there's ample room in where we are with healthcare, whether it's a Fitbit or a wearable, devices that can detect AFib. Or what have you. They're very valuable. But, I just read a recent study and they were talking about, I believe it was devices that would diagnose AFib, and the number of false positives was somewhere in the neighborhood of 84%. So when you talk about the expensiveness of the American healthcare system, and we're adding technology to it that drives the cost up because it's catching false positives, it's a problem. I absolutely think there's room for it, but I think, at this point in time, we've got to take baby steps. Every time I read something about AI, I keep thinking that, we're watching one of those sci-fi movies where they're going to take over the world. So I think it would be awesome for physicians to be able to tap databases that can think millions and billions of times faster than we can, and absolutely sort through reams of data that in nanoseconds. But I still think at the end of the day, it takes a human to human connection and human compassion to deliver the care.
Absolutely, human-centric care. So actually, this is a problem in healthcare. And I'm in center of Silicon Valley. Or anybody, I'm not a proponent of the technology in that way. As you, I'm 100% agree with you. Every guy who made money in the technology space, they think they know healthcare. That's a big problem.
Absolutely.
They learn from somebody here and there. They think they know healthcare, and then they just project. They don't understand the whole process and the real depth of it. That is a big problem. And then another area is the young, the next generation, like a Grace, that how they embrace technology. But it's got to be careful about that. I'm worried about them because they are blindly following some of these things without validating some of the things. I think that's one of the things we got to put a medical community needs to put a warnings on that. Kind of how the usage they do. So
100%.
yeah. So Dr. Koper, what kind of things you provide now services? What is your Dennis Koper at Dennis D. Koper at the Verizon.net?
Just
I saw your email there.
No, yeah. I mean, if people want to just obviously, my experience has been in kind of integrating or meshing healthcare with insurance. I feel like I understand that space as well as anyone in the country. I know that's kind of a brash statement, but I spent a lot of time in it. I grew up in it. And I feel like there's a lot of places we could go in this country to improve. And it just seems like the people that have the either the purse or the pencil to write the rules haven't driven the car. So they want to tell you how to win the Formula One race, and they've never even been on the racetrack. And I picked that because those tracks go all over Hell's Half Acre. I think it takes folks that have been in the trenches, but that can also think at a 30,000 foot level. And I just don't feel like we have that. I feel like the people with the loudest voices, are the pharma companies or some of these other folks, insurance companies, and they may not have the best interest for the health of the American population.
Very good. I think that's what they need. Standard of care. Kind of people like that give us some kind of a guidance. But all the doctors would be very helpful. And
Yep.
the how do you deal with the insurance companies? Also, you provide that guidance is very valuable. Grace, what do you think of? What do you think the healthcare should be for you in the future? People with what are you studying now? What do you go to school now? You go to college?
I just graduated. I studied psychology.
Psychology. Let us talk about a little bit about your psychology part of it.
Okay.
Mental health. It is a huge problem. It is onslaught of mental health is coming on to our pandemic because of systemic pressures around the world. I see quite a bit of mental health problems around the world. Not only just the United States now. After pandemic, we saw a huge problem in every country, particularly in urban areas. So what do you think? How can we deal with this mental health problem? Do you have some ideas, or what do you have, young woman? You can tell me a little bit about it. How we can solve this?
I think it's really good that it's starting to get so much movement behind it, and it is becoming like less stigmatized to talk about, because like up until maybe 2018, 2019, like it really wasn't ever talked about. So I think that that's really good, because I think at a young age, it allows you to like talk about things and not feel like you have to like hold it in, or you're not allowed to feel that way. I think, they talked a lot in my classes that the prevalence of diagnosis doesn't necessarily mean that those diseases are on the rise, but it's just the tests are becoming much more available to everyone. And the criteria to diagnose is becoming much more easier. Like, for example, like if you're someone that has autism, like it's way easier to get diagnosed with autism now than it was in the 90s, just because the criteria and everything. But I think we also, on the flip side, have to be careful because so many people will see like one symptom of something and be like, oh, I have that, so then I have that. But you don't necessarily might have that. But I think as long as we keep talking about it and we let more services become available to those like in rural communities or people that maybe can't afford, like therapies can be very, very expensive, especially like good quality therapy. So I think allowing people that need good help, because everyone deserves good health care, whether it's for your physical body or your mental well-being. So I think allowing resources to everyone would also be helpful, and like in schools, in communities with lower SES standards and stuff like that, I think is important too.
You made excellent points. One of them is stigma is one of the good points. Second point is that how in the schools, my son went to Vanderbilt, and it's a lot of pressure. I see that kids going through when they're in colleges, and there is not a much of a. I didn't see much of a resources there. They say go there. Kids don't go that easy. That process, that how. We need to have some kind of other kind of mechanism. Another thing is that physicians has to raise the voices. They're less stigmatized, not only less stigma, and it is also not less discriminatory. If you go to some kind of a psychologist or a psychiatrist, let's say they put you cannot be, they can see that as a negative point in the employment discrimination. That's a bigger problem, right? That's one of the problems. We need to raise the voices about that. Do you agree?
Oh,
Great.
absolutely. Absolutely. I know, for me, I played volleyball in college. So athlete mental health is another big thing. But I knew so many people that were so scared to either go to therapy or to go talk to like our sports psychologist, because they were so scared that their coach would find out and then their coach would bench them because they were like, oh, my coach is going to think I'm not mentally okay to play or I'm not tough enough to play. And it's so sad to me to think that like you are taking a step for your own health and putting yourself first to get help because of the pressures you're under, and then thinking that an adult that's supposed to support you is going to use that against you negatively and make you feel like a lesser person when you are actually just trying to help and make yourself better. But I do think we need more resources. I know at our school we have a really good student health counseling service, but if you need counseling service, you can only really see them maybe once a month, maybe once every other month, which is great. But if you're someone that's really struggling, that isn't enough counseling. And talking to someone like that can really be the difference, as sad as this is, if someone's going to be here in a week or not. Because there are some people that really struggle with that, especially at schools and in high stressful environments like that. So I think more resources and putting more funding into it and making it more of a priority.
So Grace, you spoke so well. I'm so impressed. I'm very impressed. You could be a good podcaster in the future. So, but anyway, after it's I'm going to show you. I designed a program called a Brain Cafe based on technology. I'll show you that after the program. If you stay there, I'll show you that for 2-minute video, 5-minute video. I'll show you that, and then you can say. So it's truly an honor, sir, talking with you, Dr. Dennis Koper. I know you gave us such a guidance, and it is a wonderful, that the conversation we had. And you gave me the excellent insights into the healthcare system. I think the doctors get benefit around the country, and in fact around the world. Everybody is now dealing with the insurance companies, standard of care. All these are struggling. I think you are giving us some guidance to that. Thank you. It's a privilege and honor to talk with you, sir.
Thank you. I appreciate you inviting me. It was an honor.
Thank you. And this is stay there after that I will talk with you. Just place thank you all joining. Good night, all of you. Listen to this final video.
We are retelling their stories through our patented designs that can be worn on scrubs, t-shirts, printed on conference bags, and endless other promotional materials. Daily Wear for Medicine is the first ever of its kind to create curiosity in medicine through visual art. We at MedBricks are celebrating Unsung Heroes of the Past, who made enormous contributions to the field of medicine. Through our unique campaign called Daily Wear for Medicine, you can wear it, carry it, and give it